Krishnamurthy. I'm the professor head in Siddhartha Institute of Medical Sciences, Bangalore. I'm in the field of I'm in the medical field for more than 14 years now. I'm practicing in Bangalore. Okay. And today our topic of discussion, topic of discussion is with respect to hypertension. We will just understanding hypertension. Okay. When we tell hypertension, the first question will come. Well, hypertension is the tension what regularly arises, whether the pressure in work pressure, all those things. In medically, hypertension means rise in blood pressure. Blood pressure will be in the normal range throughout the day. It will be in a range from lower range to higher range. It will always should be in the range and it will be fluctuating throughout the day. So what will happen is for some people, like nowadays, now it has become majority of the people, what will happen, the blood pressure, the range, or it will just increase and it will come to more than the normal range. Where we consider this hypertension, the pressure where it can cause damage, like in the chronic, if it is continuously, if it is the same pressure, it can cause damage to the microvascular and all the other organs that is involved in it. Organs means kidney, liver, even brain, nerve terminals, heart, all those things will just keep on getting damaged. So that is the reason we want to manage this hypertension, the blood pressure into the normal level. There is a normal range. So this will not happen, and even the blood vessels will maintain its elasticity. So what will happen in hypertension? If blood vessels will lose the elasticity, and again the damage will start occurring along with other comorbid conditions. We have systolic and diastolic blood pressure. Systolic blood pressure is what we consider, like if I consider normal blood pressure as 120 by 80. 120 is the upper number will be the systolic blood pressure, where it will show the pressure that is exerted by the blood on the blood vessel when the heart is in contracted mode. And there is another number that is diastolic blood pressure, that is the second one, where the blood exerted the pressure on the blood vessel when the heart is in the relaxed mode. So we will count both the systolic as well as diastolic blood pressure. Both are very important, and more specifically, we have to maintain the blood pressure, both systolic and diastolic, in the normal range. So this is with respect to like what blood pressure is, what is hypertension is, and what is the normal range. So nowadays, for many people, they will not get any symptoms at all. There won't be any problem. Just there will be rise in blood pressure, and after some time, maybe after years together, they will come with a complication. That is the most dreadful condition. Once we lose, like if there is a variation in the blood pressure range, it can lead to the damage to the microvascular, the tender organs. That is the one thing. So how to maintain this normal blood pressure? That is very important. So there are many risk factors that will occur. One is modifiable, others are non-modifiable. Like we are age, we cannot control the age. We cannot go back and go to the earlier ages. So age we cannot consider. We cannot control the age. Second one is our genetics makeup, family history. These are the things which we cannot again modify. But there are many other risk factors which can be modified. One is high salt intake, the most important one. We have to reduce the high sodium intake. Salt means here sodium chloride. We have to reduce the sodium chloride intake by reducing like food what we eat from outside, and also restricting the extra addition of the salt for our routine use. That is one thing. Second one is exercise, which will reduce almost 10 to 11 millimeter of mercury of blood pressure. Exercise, we have to do regular exercise, and this should be like continuously, like a brisk walk, jogging, swimming, all these exercises. This will help in reduction in the blood pressure. Third one is stress. The stress-free is very important. Whenever we have any sort of problem we have to be stress-free, and with the relaxation, that is relaxation techniques will also help in daily routine activities, because that will alter the sympathetic system. Our body will be balanced with sympathetic and parasympathetic. So with extra stress, sympathetic activity will increase, heart rate will increase, blood pressure increases. That is one thing. That is chronic thing. The next important factor what we can modify is smoking. smoking, chronic smoking, it can also affect the blood pressure, rise in blood pressure, and also regular alcohol. Alcohol more than 50 milligram per day, which will cause hypertension. So that is also again very important factor. We have to these are the modifiable risk factor. Apart from all these things, we have to maintain or regularly check the blood pressure. If we are suffering from hypertension, regularly, constantly, we have to keep on checking the blood pressure. You can visit the doctors, get checked, or the better win is self-monitoring. You can have your own sphygmomanometer. That is a BP apparatus. You can have your own BP apparatus and then check in the early morning period. That's the most important. Again, in the evening. These two are the important phases where the blood pressure will be in the higher side. So we have to maintain or check this blood pressure on during that time at your home only, and then you can help. You can contact your own personal doctors. They will help you to reduction in the blood pressure. And always remember, if blood pressure is not in control, even with salt reduction, exercise, or all these modifying risk factors, what you have, we can modify. If it is not controlled, high the blood pressure, the drugs is very important. These are the life-saving drugs. We have to remember. These are like the Sanjeevani, what we will tell. These are the life-saving drugs. They can save our lives. Don't we cannot think like why should I take the anti-hypertensive drugs every day? But this will help. Maybe like the salt restriction or exercise may not help for some patient, but the drugs will definitely help in reduction in the blood pressure, high blood pressure, and maintaining it in the normal range, and it will prevent the silent killer hypertension. So that's why always we have to remember the drugs is very important if it is not controlled. At the end, I like to conclude that our life is most important. Nothing will help. For our life, we have to have very good health, and everything on this planet depends on the healthy life. If the life is, if it is unhealthy, we cannot do anything, and our surroundings will not be in a helpful mode. So that's why always keep your blood pressure in the normal range and enjoy your life. Thank you very much.